Thank you, thank you. Well, good morning. You know, as if there's not enough stress of standing in one place and pushing the clicker and making sure you speak loudly, now I have to speak behind AlphaZilla. It's an honor to be with you all this morning. I want to start with sharing a little bit about the foundation because in 2014, we had a significant event. The Alpha One Association and the Alpha One Foundation merged together, and with that, recasted our vision or our mission. So I want to start with that, talk a little bit about our mission, and then go into some of the things, as you've heard some of the other presenters, that have transpired between the time we were together in Barcelona to the time we're together here in Italy. The Alpha One Foundation is committed to finding a cure for Alpha One antitrypsin deficiency, underline exclamation point, and to improving the lives of people affected by alpha worldwide. We chose those words very carefully. We see our mission not only as what we can do in the United States, but to be a collaborative partner across the world. And one of the things, and I would share what my Canadian colleague Mimi said, is this is the second international meeting I've been to, and every meeting I've walked away with ideas that I take back to my organization and say, this is something we can do, this is something I've seen, this is something I've learned. So please, please, please underline, share with us, talk with us, share your ideas, because we certainly come with our hands and our minds open to say what can we learn and how can we help. The Alpha One Foundation really boils down to a very simplistic approach. We're here to serve alphas, and this is just a cross-section of the American landscape for alphas. You see very small alphas, you see some older alphas, we have an alpha that looks like Santa Claus, you can take your pick. But ultimately, the organization is really designed to serve the alpha community. We look at our mission broken into 5 pieces, and they're certainly not all inclusive. When you look at American alphas, we talk about roughly 1 in 2,500 people in the United States are affected by alpha. Based on our last census, that would amount to about 120,000 alphas in the United States. We've identified, depending on which number you look at, between 7,000 and 10,000. So we have a ways to go, and we have a lot to do. Our first mission, first priority is finding a cure. And you all have heard John talk about that passionately, and that's a passion that we all share. Second is detection. Once we've identified an alpha, how do we support them? How do we make sure that education is available to them so that they can see and learn and grow and know more about their condition? And then ultimately, how do we advocate for ourselves in a country much like Canada that has a complicated healthcare system? There are over 4,500 American alphas enrolled in our research registry. There are about 10 different research projects or protocols going on in the US right now. We have clinical resource centers spread across the country. We have over 80 centers that are connected in 34 different states. They interact with support groups. They're available as a resource. One of the big efforts in research for us is to make sure that when a researcher says, I need a pool of alphas committed to be part of this program, that the alphas step up and do that, and we're effective at that. And it's one of the things that I think we can be proud of in the US. The other side of research is funding. And since inception 20 years ago, we've contributed $54 million to over 100 different institutions worldwide. So those are really the 2 sides of research in America. The alphas that are willing to participate and being able to fund it. Detection, again, is a large part, and many of the things you heard from Mimi are things we work with. Even though we do have genetic laws and regulations, we still have challenges around that in some areas, and we have the confidential testing program, the alpha coding testing. We encourage family testing. Obviously, it's a genetic disease. One of the things we see in the United States is, as an alpha is identified, to make sure they have the tools to have that conversation with their family. We work on education around testing, and we've certainly partnered with the COPD Foundation to extend that reach as far as we can. There's over 80 support groups nationwide. They range from groups of 10 or 15 to groups of 200. We have a virtual support group where alphas can dial in to a phone call and be part of a dialogue with that. We run 2 of those a month, and we have a patient information line that's answered 24 hours a day, and a peer guide program where potentially a newly diagnosed alpha can be partnered with an alpha that's in the same area that can support and provide resources and be close to that. I've done that myself, and it's a rewarding experience as an alpha because you know you're helping someone else, and it also provides, in a non-threatening way, a newly diagnosed alpha someone to talk with. Patient education is a big part of what we do, and making sure that the resources are available there. You've heard some of the things that we work with. Our educational materials available on the website, our education days, our national conference. By the way, it's in Orange County, California this year in July. If it wasn't exciting enough to come to the Alpha One Foundation National Conference, Orange County is also the home to Disneyland. And then e-education, again, go to our website and you'll certainly be able to see a number of lectures. Basically, just about everything that we do physically, we record and make available on our website. Public policy and advocacy. Advocacy really has 2 sides to it, the patient advocacy around patient-driven issues and the public policy advocacy around how do we make sure that we have a voice as America shapes its health policy. And you can see some of the things there. I won't read them all, but actively involved in that, both in Washington, D.C. at a national level and in the 50 states all across the country at a local level, making sure that the alpha voice is heard. Highlights since Barcelona. This is really what's transpired since then. The biggest is, as we all did, we celebrated the 50th anniversary of the discovery of alpha-1 antitrypsin deficiency, and it's interesting, I thought about that, and I'm 56, so I was an alpha before there was alpha. It's nice to be a trendsetter. The celebration went on throughout the year. We used it as a milestone to start discussions. We used it as a celebration in our alpha events, and certainly tagged all of our information to make sure that people were aware of that. It was the start of Alpha One Global, and we're certainly proud to be part of that effort and appreciate the work that's gone into this conference. Honey, thank you very much for your leadership there and the steering committee. to really make this opportunity something that we can all learn from. And then, as I said when I started, we merged the association, which was primarily patient-focused, into the foundation, which was patient-focused, but also had a keen research, so that there now is one voice in the United States for alphas. It was a labor of love to go through that process. It was done, I think, with a lot of integrity, with a lot of respect of both organizations, and in this case, 2 + 2, or 1 + 1 equals a lot more than 2, and we've been able to accomplish, even in the short time that we've been together, I think far more than we would have if we continued separately. A big part of our celebrations is our 20th anniversary, and it's hard to believe that the organization has been around from 20 years. There's a lot of work that has gone in there. The 20th anniversary really started off with a celebration of all of the volunteers that have made this possible. Thousands of people over the 20 years have committed time and energy and resources to get us to where we are today. And I would be remiss if I didn't take a moment and stop, not only to thank them, but also to remember many of them that are not with us today, because without their leadership, without their energies, without their commitment, we would not be where we are. And I think if you need a commitment to get out of bed the next morning and take that next step and to continue that journey, looking back at our 20-year history is pretty energizing from my perspective as to where we go next. We are not without our challenges. You've heard other people talk about access to augmentation. We do have augmentation therapy available in the United States. However, access to it varies state by state, varies by insurance provider, and those are things that we actively advocate for. The healthcare system in the United States is changing, and we're moving to a population health model, which many would say is wonderful. However, rare diseases don't really fit well into that model. So making sure that the alpha community has a voice and that our needs and our concerns and our care levels are considered as we move forward. We continue to wrestle with what I'm sure all of you wrestle with, a lack of awareness about a rare disease and a lack of detection efforts so that people that are affected by it can have access to treatment, education, and support. And lastly, I would end with the resources that we have to overcome this. That picture is a group of alphas that rode in the Escape to the Cape. It's a 160-plus mile bike ride. The purple shirts at that event were overwhelming. But we have a strong alpha community. The association and the foundation come together, have given us really an invigorated foundation, and we are close to a cure as we look worldwide, and we want to make sure we continue to push that. So let me end with sharing my contact information and our website. I look forward to talking with you through the rest of the day and tomorrow, and if we can do anything for you, or if you have ideas that you think we would benefit from, I look forward to hearing them. Thank you very much.